is both a CATS celebration. Welcome everyone to our open house here at 1171 Mission Street. This is both a CATS celebration, Community Awareness and Treatment Services, a private nonprofit that's in collaboration with Department of Public Health, and also a celebration of our new medical respite program, which is an expanded version from what we had before. We have the Honorable Mayor Gavin Newsom here today. He's been extremely supportive of this project, and as you're very well aware, he's made homelessness as his #1 issue and has taken a very hands-on approach. So we're very lucky, I think, to have had his support through the last few years. So Mayor Gavin Newsom.
Thanks, Janet. Thank you. Thank you, guys. I have no idea why I'm standing outside and you're all inside. I kid you not. This, I'm going to talk to my staff after this. Honestly, awkward. But thank you all. And for those of you who are watching at home, we've got 100 folks or 50 folks behind you, behind the camera, and I want to congratulate each and every one of you for all your hard work in helping us get to this point. To Janet and her team at CATS, I just admire the work you're doing. I appreciate the heroic work that you have done for so many years in our city, and the work that will be made possible because of the generosity of your board, the generosity of all of those of you that are assembled here today that made this day possible, to take 3 centers and to aggregate them into one, to take a respite model of care and to connect it with a sobering model of care, to address some of the disconnect in terms of the components of our healthcare delivery and homeless delivery system, and look at connecting them in a more substantive and collaborative way. We believe that if you want to maximize or optimize individual components, you're going to get only incremental change. If you want to dramatically transform the way you deliver services, you have to look again systemically, not just in terms of those individual components. And I think that's the spirit that brings this center to this location here today and officially allows us to launch this project. You've got 42 respite beds. You've got 12 sobering beds here on site. The combination allows for 2 things. One is pre-hospitalization, the idea that someone is out there with chronic challenges associated with inebriation, someone that's chronically drinking, in essence. They're out on the streets and the sidewalks. Rather than bringing them directly to an emergency room where they take away an emergency bed and increase the propensity or likelihood that there'll be ambulance diversions, we're able to now take them to a sobering center where you have a medical staff that's here that can make sure people are adequately served, that we're not missing something as it relates to the prospect that their issue of inebriation may actually be a bigger issue that is hidden. And again, that's always been the argument against an alternative or an intermediate care facility to an acute care facility. But when you have the medical professionals on staff, then you provide that confidence that we're going to be taking care of that individual even beyond the self-evident issue of alcohol consumption. So you've got that component here, and those are the beds you see downstairs, and we provide those beds not just for men but also for women. And then you've got the post-hospitalization strategy, which is the respite strategy. So, for example, you have someone that goes into emergency room. They're there for X number of hours. They may be sobering up themselves. For whatever reason, there may not have been access to the sobering center here, or there was a lack of there was just lack of confidence that that was the primary issue, so the emergency team sends them to an acute care facility, one of our 10 in San Francisco. That person clearly is sobering up. What do you do with that individual? They still need time, they still need support, but they're taking up a very expensive bed, and they again are taking away a bed from someone that may need it even more. So now you can bring them to our respite facility right here. So this just makes ample sense. Again, true common sense is at play here with this new facility. But it could not happen without partners, not just CATS, but the Department of Public Health, which has, of course, led the way. I see Dr. Barbara Garcia here. I see, of course, her great team assembled, and I thank them for their wisdom and their support and their counsel. Mark Trotz and Dariush Kehan and their incredible and ongoing leadership to advance our collective efforts here to turn the corner in terms of chronic homelessness as well as homelessness in the general sense. And our partner, our angel of sorts, and an angel that I have been promoting, I think, amply in the last few weeks, and notably today, and that's Kaiser. Kaiser put up $250,000 to help build out this facility, and wouldn't have happened without Kaiser. So if I can get a big round of applause for Kaiser, thank you. We are very grateful, truly. Some of you know this, but more people should know it, and I think more people just got a chance. I just had the privilege of being on with the head of Obama's healthcare efforts, Nancy Andoparo. We were just on a national TV show together, and today we were promoting the fact that San Francisco's public option, our public plan, you hear a lot about public plans as it relates to healthcare in the United States, and President Obama is about to do a town hall meeting to talk about the public plan and the public option. Well, there's only one public plan and one public option in the United States of America. That's the city and county of San Francisco. What's remarkable is today, July 1st, 2009, we have one of the largest health insurers in the United States of America, certainly the largest HMO in the state of California, Kaiser, that is partnering with our public plan. That is newsworthy, I assure you, because the frame of the national debate is health insurance, big insurance, hates public plans and is there to destroy public plans because public plans create competition and will ultimately destroy insurance companies. I happen to think more enlightenedly and happen to think that Kaiser, to their credit, at least here, I can't argue what they're doing back in Washington, D.C., but at least here has seen the wisdom of joining and partnering with our public option. And so, Kaiser, this should be your day in the city and county of San Francisco, but I just haven't been that proclamation yet. So thank you for that. Final point, you know, a lot's been written, some accurately, some wildly inaccurately, about the budget this year. We were in very late last night, and my team, I think Steve Cava, signed off. We were doing text messaging back and forth. At 12:38 was his last text message saying we're done for the night, and they're reconvening. We are this morning on our own budget. We're going to substantially, as I said when I submitted the budget, and I tried to calm nerves then, but it didn't work, and I understand the theatrics at times and concerns, legitimate, sometimes very legitimate concerns, but we'll substantially address those direct service impacts, and we'll be in a very good position to continue to lead the way and lead by example in this city in terms of our healthcare delivery on substance abuse and mental health and the like. And you'll see that exampled when the add-back list is announced shortly. And I want to just thank everyone that worked diligently to work together and compromise. Now, I don't know what the final product will be because that's going to be determined in the next few hours, I hope at least. And we still have a lot of disagreement, but we look forward to advancing our common wisdom, and that will certainly be with the prioritization, as I stated in my budget, that substance abuse and mental health are my top priorities in terms of those add-backs. Those are the most difficult cuts to make, and already we made technical adjustments to some of our delivery, and Dar was on the phone quickly saying, why did you cut this program? I said, Dar, we didn't cut this program, only to find my budget of thousands of pages, and I said, my gosh, how did that get in there? And so there were a few programs that we, just 2 weeks ago, also technically adjusted back. And I say that because it's important. The backdrop of being here and celebrating this respite center is, I think, in obvious relation to what's going on in terms of the larger macro budget. And I want people to know that we're not going to get everything we wanted because of the economic realities, but we're going to get substantially more than I think even our worst critics expected. And I think that's also a very good thing. So thank you all for all your hard work. Thank you for continuing to lead by example. Thank you for advancing this remarkable model. 9,535 human beings. As of today, Dar, that's your number. 9,535 human beings are off the streets since we started 5 years ago, and that's something truly to be proud of. Thank you all very, very much.
So I think that, we can keep the podium where it is, and we can just continue with our program. And again, I want to thank Mayor Gavin Newsom for everything that you've done to really make a difference, I think, with the homeless problem and be a catalyst, I think, for very innovative programs. Coming here today is really the result of a joint venture, and that was between CATS as a private nonprofit, the Department of Public Health, as well as St. Anthony Foundation and the Kaiser Foundation. And again, it's one of those situations where you can do much more together than you could ever apart. Our lease at 1446 Market Street was up, and so that meant that Mark Trautz, who oversees medical respite, and myself were diligently looking for a new place. And through a fortuitous set of circumstances, we found St. Anthony Foundation, which was perfect for our situation. Not an easy thing when you're trying to move services that are involved with homeless services that really don't want you in their backyard. CATS is a very special partnership between Department of Public Health and also and what we bring, I think, to the table is that we have that special niche of serving people that are the most at risk, the most difficult to serve, homeless individuals on the street. And we do that by hiring people who come from the streets themselves, who are in recovery and really understand what it is to be homeless. We marry that with the expertise of Department of Public Health, their mental health expertise and also their medical expertise. And when you get those two forces coming together, you can really have a powerful impact on the program and on the problem. Medical respite and sobering services is another example of that partnership. CATS provides the supportive services, and that means the one-on-one connection. It also means the janitorial, the food, and the transportation. And we get the medical expertise of Department of Public Health, as well as the mental health expertise through social workers who connect people with services. CATS admin and mobile assistance patrol, MAP services, are on the second floor. You see medical respite both here on the third floor as well as on the first floor. And you'll be touring that later if you have an interest of learning more in depth about those services. MAP is unique. It's the only 24-hour outreach and transportation service in the city. People assess what's going on with a homeless person. The paramedics and also the police really depend on that service. When they're not transporting someone, what they're doing is they're really patrolling the streets to find out who needs services. And they're a backup to the San Francisco Homeless Outreach Team, which has been another collaboration that we've been fortunate to partner with Department of Public Health on. I want to thank several people here today that both made this happen and also made the program happen. We have music by Kitty Martin, who is our Executive Administrative Assistant, and also her friend Scott. She's multi-talented. We have an open house committee actually put this together. So Taywall Stanley is the director of medical respite. He's over here. He takes care of the daily operations. Yvette Blair is the program coordinator. She's a CATS employee. She oversees the food services, etc. Harry Bahari is the CATS finance director. He's here. He's our roaming photographer. Max Happenstall is the director of MAP services. He's also here, and we'll be giving tours later. And I want to say a very special thanks to Mark Trautz, who oversees the medical respite program. I've had a chance to get to know him well and to really form, I think, a very workable partnership with him. It's through his generosity that CATS is able to also claim this as their house. Wolfgang Stua is from Department of Public Health. Wolfgang, if you would raise your hand, please. Wolfgang oversaw the construction of this place, which was no small matter and really required a lot of diligence to make happen. And Susan Sakuma is from Asian Neighborhood Design. I think she's here. She was the architect, and she took our ideas and she made them possible. So thank you, Susan, for doing that. The Kaiser Foundation has been mentioned. You really were the angel that came along at the right time. Your very generous gift really brought our dreams to fruition. So your generosity in supporting medical respite is very much appreciated. Ken Neal, I think, is here. He's our CATS attorney. He may not be here. I don't see him in the audience. But anyway, he was the one who crafted our lease and worked very closely with people from St. Anthony Foundation. And from St. Anthony Foundation, Linda Pasquinucci is going to be speaking later. She's the interim executive director, and I know Father John Harden is also in the audience. We're very glad that you could join us today. And a final thanks to Barbara Garcia. We've known each other for 9 years. We clicked from the beginning. And I think our mutual appreciation and understanding of each other's abilities has really resulted in a lot of different kinds of collaboration. We've done better and better programs together. So the San Francisco Homeless Outreach Team is an example of that, as well as the medical respite. So you're going to be hearing from all of these people later as we go down our program. So, and in fact, Barbara Garcia, who is the Deputy Director of Health Services, is going to be saying a few words now.
Good afternoon. I'm so proud to be a part of this. I wanted to let you know a little bit about how we did this, though. As you remember, the McMillan Center, I wanted to acknowledge Leo McMillan, who's in the audience today. And Leo has been a long-time board member of CATS. I understand it's your last term. But McMillan Center was named after Leo, and for his commitment to these to individuals in our communities who were in need of a respite, in need of a sobering center. We took the McMillan Center and really advanced it to another level, I think to the 21st century of supporting individuals in the community who are seeking support for their alcoholism, and then also those individuals who don't have a place to go to recuperate from the hospitals. You heard our mayor, you can hear the deep understanding that he has of our programs. So it's a really easy thing to be able to come together because of that leadership. But I did want to acknowledge a couple of individuals who had, beginning in 2007 when we started the Sobering Center, Ron Smith from the Hospital Council, who sat on that committee and really helped us work with all of the hospitals in the community. Michelle Snyderman, who is the medical director, really helped us link individuals from the hospital into the respite. And the other hospitals as well have the opportunity to bring individuals into the respite and the sobering center. When individuals clear from the hospitals, we can also move back into the sobering center as well if they are in need of more support. This is an incredible process of partnership and the individuals committed to the community. But most, I just want us to really focus today on the individuals who really use our services. They get the opportunity to not only just come to take care of what they need for today, but to talk about tomorrow and where they're going tomorrow. And we have the ability to move people into a more stable environment when they leave here. And you can see the demographics through when you walk around of the impact that we've had of ensuring people get housing, the connections to their medical care, and all of the benefits that they do deserve. So I want to thank all of our partnerships, particularly Janet Goy. Janet and I met one night trying to open a shelter, and we opened it within 48 hours during El Nino, and we housed 700 people there on a nightly basis for over a year. And Janet, when I said, Janet, we need to go left, Janet was right there going with me there. So I really want to thank CATS and all the partners, and particularly the DPH staff who have really made this happen. So thank you so much, Mayor Newsom, for your support and leadership. Thank you.
Thank you, Barbara. And now I'd like to introduce Elisa Grukak, and Elisa is our CATS board president, so she's here to talk a little bit more about what CATS is all about. Elisa?
Thank you so much, Janet. As Janet said, I'm Elisa Grukak, and I'm president of the board of CATS. We're here to celebrate the opening of the Medical Respite Center and, of course, CATS's administrative offices. But I wanted to take a moment to make sure that everyone is aware of the full breadth of what CATS has to offer in terms of programs and services. So in fact, CATS has 9 programs, ranging from first response with the street outreach, to shelters, to transitional housing, to permanent housing, and along the way as well, substance abuse treatment and relapse prevention services. I'd like to highlight 2 CATS programs that we're especially proud of because they're so unique, and that is the Coronado Hotel program and A Woman's Place. So the Coronado Hotel is a private residential SRO building that provides formerly homeless individuals with housing and supportive services on site. So really in terms of this permanent supportive housing model is really at the forefront of that. In addition, A Woman's Place is the only 24-hour supportive shelter that serves the needs of women and transgender women with special needs. So the focus on women as a subpopulation is a real hallmark of the success at A Woman's Place. And in fact, CATS has many programs that focus on subpopulations such as seniors, women, and other kinds of populations. And that very, very targeted focus is something that's really a hallmark of many of CATS's programs. So CATS is a network of programs that really provide a safety net, as many people have pointed out today, including Janet, to that hardest to serve population, the population that no one else will serve. A wise sage once said to me, you know, Elisa, you're probably not going to get a homeless person off the street or solve his or her problems by giving him money. Even a quarter, $1, $10, you're probably not going to solve that person's problems, but you will keep your heart open. And that really, really stuck with me. And so when I do hand somebody some money, I do focus on keeping my heart open as I do that. The real way to affect change, this person went on to tell me, is to get involved in public policy. That's where change really happens. And that's why I became involved with CATS in the first place, was because I wanted to have an impact on public policy, and I could see that CATS was at the forefront of not only mayoral initiatives, but public policy, and as Mayor Newsom pointed out, trends that we're seeing roll out across the country today. So I am extremely proud to have been involved with this organization for the past 3.5 years, and to have partnered with many of you here in this room, many of whom have been involved with this issue for a whole lot longer than I have, but I look forward to partnering with many of you in the future. And with that, I will turn things back over to Janet.
Thank you, Elisa. So now I'd like to call Mark Trotz to the podium. Mark Trotz, Director of Housing and Homeless Services, and he will talk more about medical respite.
Thank you, Janet. It's wonderful to be here. You know how there's some projects that just kind of fall together? Well, this wasn't one of them, actually. And it's generally those projects that prove to be the most rewarding when you finally get here, because it was just one of those initiatives that we had a lot of trouble finding our final home, but then there was so many people out here that we met along the way that got us here. And of course, it first started with Mayor Gavin Newsom in our 2006 budget, probably, really ramping up the staffing within our section to be able to provide the services for this new idea for a respite program. That was before the worldwide economic meltdown, and it was really hard to find a spot to do it. So we had to get creative to get this thing off the ground, because he can sometimes not be patient about programs that he's funded, and he likes to see them happen, which I don't blame him. So we were just like, we can't find a site to do this. What are we going to do? And that's where we, with Barbara Garcia's help and Janet Goy's help and Mitch Katz's and a whole bunch of others, we went to Plan B, which was use 2 existing sites, which we started in 2007, and that was retooling 39 Fell Street, which has been mentioned, and then going into a corner of Next Door Shelter, one of our large city shelters, and ECS runs that shelter and helped us do that, and that worked. I mean, we got it going, and we started experimenting with respite. We kept sobering going, which had preceded that at Macmillan. And then as things would happen, We lost the lease at 39 Fell, even though we'd had it for 20 years through 10 renewals or something like that. And we needed to scramble. And that's where the next phase of the journey came in, and where just really coincidentally, I think it was Dar and Father John Harden were, hey, you know, this facility may become available. St. Anthony's needed to make some changes in their organization, and we just seized the moment. We were like, are you kidding? The Marion Residence, or the former Marion Residence, is a beautiful building. We know that St. Anthony's ran a fantastic program here for 10 or 11 years, and it was just one of those really lucky turns, and we just switched into gear, and in the course of it, we're able to develop this site that also is a new core home for cats for their next 50 years of progress. So it's all here. I think it's really great to have something like this. San Francisco, again, through Mayor Newsom's leadership, we're one of the leading cities in the country on housing first, and we do get a lot of people through the health department and HSA and other venues directly into housing. But we all know that that's not possible all the time, and this was a glaring gap in the system, that we needed to have a place where people could unwind, recover, recuperate, and get back on their feet before getting into housing. And I really credit the staff here, Dr. Michelle Schneiderman, Taywall Stanley, Alice Wong. There's others sprinkled throughout in their amazing success in getting people into housing. And that's really the core goal. We didn't want to set up something else that was just another turnaround. And something like 40% of the people who come here, and in our business that's high, wind up getting into a more permanent housing setting. And these are people who may have been recycling through various locations in the system for 10 and 15 years. And so when you interrupt that cycle, that's just fabulous. And what that does for that individual to start sending them towards a trajectory towards stability is just what it's all about. So just a couple more thanks. Carol Bailey is there. Where's Carol? Put your head up. She's fantastic. She still works for the health department. She went to Laguna Honda, but she really pulled the two respites together in their former locations and really did it under a lot of time pressure and a lot of duress, I would say. And out of nowhere, really hired the staff and helped us create this. And so that's just really fantastic, and I'm forever indebted to you for doing that. Thank you. And in terms of the current staff, Taywall and Michelle are kind of holding it down on a daily basis. John Wiskin, I saw back there, is the social worker, helping get people into permanent housing and just doing a phenomenal job. St. Anthony's, again, thank you so much for working with us. This feels like a much better landlord than 39 Fell. Off script, Janet and I can tell you some stories about the landlord at 39 Fell. Very interesting. So thank you so much. And this will, we'll take care of this building, and it'll be a great partnership. And then, of course, Kaiser. Christine, thank you so much for coming out of the blue. Michael Cox is also here, as well as Randy and Laura Salee. Michael was just very cool on the phone. He was very easy about this. He started apologizing about the application I would have to fill out to get the $250,000. And it was like a page and a half. I mean, I have to do 10 pages just to get the application from SAMHSA, And this was the whole thing, and he was apologizing for the paperwork. So you guys are well on the way to streamlining, and it was a very symbiotic process. Cats, I really enjoyed working with you, Janet, and your staff. You're so flexible. We've gone through a lot of changes, and a lot of times there's not time to kind of hash it out in all the interpersonal ways that you would want to, and it sometimes comes out with, okay, well, now we need to move, or we need to do this, or we need to do that, and we have figured out a way to just cut to the chase and get it done. So I very much appreciate the partnership. And A&D was already mentioned, but I just want to mention them again. Susan's here. She designed this. This is like the fourth thing she's done in the last couple years with us like this, that are just, you can't come in and be all prissy about the architecture and this and that when you have 4 months to get it done. Although the architecture is beautiful, but she really knows how to just roll up her sleeves and say, we're going to do this, we're going to put this flooring in here, we're going to do that, and it's going to look great. And that's what happens when you work with Asian neighborhood design and great community-based architects. And if I haven't already mentioned, just again, Barbara Garcia is my boss, and she's pretty much the best boss you could have. And it's just great working for her, because when you're on the right path, she just encourages you and lets you run with it. When you're on the wrong path, that's not so good. But she gently helps you change course. And finally, San Francisco General has been a great partner in all of this. I know staff from San Francisco General are here, and while we started with the respite taking referrals just from San Francisco General, that really allowed us to hone down our process and work out this thing called an e-referral and other things that we've done. And it's so mutually beneficial to be working together like this, and I think that's sort of been the hallmark of one of the things Barbara's been doing and Mitch has been doing, is bringing these systems closer together so hospitals and community-based care aren't two separate things, and we use them both appropriately and not overspend on one side and underspend on the other to the detriment of the entire community. So anyway, I'm just really glad it was a difficult process, because then we wouldn't have gotten to here if we didn't keep turning it over. So thanks a lot.
Would you like to do a presentation or something with Kaiser Foundation?
Yeah, I don't know if we have that. Is that what's next?
Yeah. So now I want to introduce Christine Robish, and she's from the Kaiser Foundation. She's the Senior Vice President and Area Manager for the Kaiser Foundation Health Plan and Hospital San Francisco area. So I hope I got all that right. But I believe if you would come to the podium, please. And she's going to tell us more about Kaiser's part in all of this.
Well, thank you, Janet. I really appreciate it. Mr. Mayor and all of you and honored guests, it is truly a privilege to be here. What a wonderful day, and congratulations to all of you. Mark, I know you've put in a tremendous amount of work, and it's a privilege to be a part of it. Medical respite and sobering programs are a critical service to the city's most vulnerable population. And at Kaiser Permanente, we are committed to improving community health, and that means the whole community, including our homeless population. And so we want to reaffirm that commitment here today. I had the privilege about a year and a half ago of touring the 39th Fell Respite Center with Dr. Michelle Schneiderman, and I was so overwhelmed and impressed with the quality, the commitment. It was absolutely incredible. And so contacted our regional community benefit group and said, this is a wonderful program and we need to do more. We need to support it. It's an important piece of the fabric of the healthcare delivery system here in San Francisco. And so we came to today, and we were pleased to be able to donate the $250,000 toward bringing this center to life. Thank you. What's also so impressive about this center is that it's going to increase, and it has increased, the bed capacity by 30% for respite care, and it has increased the sobering bed capacity by 50%. And that means that we're going to be able to serve more people. So in summary, I would like to thank all of you. I want to congratulate all of you for all of your efforts, and a special thank you to you, Mr. Mayor, for your leadership on healthcare access and healthcare reform. And we will continue with our public-private partnership. Thank you so much.
And now we have a client from Medical Respite, Mr. Dustin Hoffman, and he's going to talk about what this experience has meant for him. And it's truly why we're all here today. If this experience doesn't make something happen, if this isn't a good experience, then we truly have not done our job. So this is truly what it's all about. Mr. Dustin Hoffman.
Wow, there's a lot of you out there. Anyway, I want to say that I have heart disease, and I ended up in San Francisco General, and they led me to this medical respite, and I was homeless at the time, and I don't know what I would have done if these people didn't help me the way they did. And it's not just the building, though, it's the people here together that they help you, they become your friends. If you need to talk, they're always available for you, and I hope this place stays open for a really long time, because I know it helped me a lot. Thank you very much.
So we have one other person who would like to come and speak, and please, and just give us your name.
Hi everyone, my name is Sylvia Reese. I'm glad to be a part of this. I think Respite is a very strong place. I have cancer. When I got out of general, they brought me here. I've been here ever since. I have tonsil cancer. Right now, I'm still going under chemotherapy and radiation. I finished radiation in 26 weeks, and the chemo is still working. It hasn't wore off yet, so I'm very blessed to be here with a whole lot of staff that's lovely people. They are very helpful to me, and I'm glad this place is open because I wouldn't know what to do, and I wouldn't change it for the world. Thank you. God bless you all.
Thank you very much. And then finally, we have Linda Pasquinucci, who is the interim executive director of St. Anthony Foundation, and she was the person that we worked very, very closely with in order to make this a reality. So, Linda.
Thank you, Janet. Thank you. I'm very happy to be here today and very proud to be representing St. Anthony Foundation. It is a blessing for the city of San Francisco that CATS provides these much-needed services for the people who would otherwise have no adequate place to heal once their acute medical needs have been addressed. When patients become ill, they are treated in the hospital and in the emergency rooms and then sent home. But you and I have homes to go to, and the homeless, the home is on the street. It was the desire of St. Anthony Foundation to find a social service organization to utilize this space that served the disenfranchised in our society, and an organization with similar values of treating the disenfranchised with dignity and respect. And it is really through the relationship of Father John Harden and Dar that this all kind of came to be, and they're just casual conversations, so that's why we're here today. For those of us who work at St. Anthony Foundation, we see our ministry as providing basic needs to help people towards stability. We view CATS and the medical respite program as the extension of that ministry. We realize that in order to provide the array of services that meets the complex needs of the homeless, organizations like ours need to partner and to help each other. We realize that no one organization can do it themselves. By providing a safe, secure environment in which to recuperate, in addition to one-on-one support, the CAT staff is able to engage with the clients, and engagement is key to providing a gateway to stability. All organizations are feeling the stretch right now, but none of us are feeling it as much as the people we serve. In the current economic conditions and environment, collaboration between agencies is critical because it enables each agency to concentrate on what it does best. By doing so, we can provide better services to help people from revolving through the emergency rooms and hospitals to a more stable environment, and hopefully to a more stable living environment. And I think you heard today that 40% of the people who are helped through the respite program and medical respite eventually do find housing. So we are happy to have CATS, the Medical Respite and the Sobering Center in this beautiful building, which we took great pride in. And we look forward to a continued relationship and their ability to provide a clean, safe place for people to recuperate, engage, and heal. Thank you.
Now you know why we're in love with our new landlord. It makes a huge, huge difference, I think, to have someone who believes in the same mission that we do. We do have tour guides if you'd like to learn more about the program. So if you could raise your hands, we have people from Medical Respite who will talk with you more about what medical respite services are all about. That means that you can gather with them. Max Haftenstall is here from MAP. Max, right there in the back. And also we have two people from CATS who can take you through the CATS offices and describe more what these programs are all about. So with that, the mayor would like to see something else.
Remember I mentioned that it should be Kaiser Permanente Day in San Francisco? Well, just magically, this proclamation appeared. It's Kaiser Permanente Day in San Francisco. Thank you, CATS. Thank you, St. Anthony's. Thank you, all of you, for being here today. Thank you. All right. Shall we tour?
Yes. Thank you very much. There's food and there's touring.